When it comes to kind of looking at these cases as a whole, where are we when it comes to gathering the data to understand how people react? And I'm even thinking now about the use of technology such as artificial intelligence to look at old clinical trials and kind of analyze people's specific, tumor-related data. Where are we with that, and what are your hopes? What do you hope to see in that area?
So certainly, we have had some clinical trials that have shown some the prospective implementation both within the U.S. and internationally. Unfortunately, gathering more prospective phase 2 trials is going to be challenging, and we do not see that unfortunately happening soon, but we do know that academic centers are more and more implementing this approach. So where I see that probably we will be continuing to gather this data is through registries, through real world experiences, and hopefully as precision medicine becomes more incorporated early on these thyroid cancers, we'll be able to develop predictors of who can undergo redifferentiation early on, who are the best candidates, what are markers of response, and when's the best timing, because we see a lot of heterogeneity in practice in that sense.
What do you see as the biggest areas of challenge when it comes to this? Are there kind of some demographics or some kind of case profiles, I would say, that are more challenging than others?
In advanced thyroid cancer, in general, there's certain areas where there's still a lot of opportunity. Certainly, I think in the landscape of access to multidisciplinary teams, we have amazing centers through the U.S. That have experts, but we know that not every patient can make it to one of these specialized centers. And so how we work to get that same level of expertise to each and every patient with advanced thyroid cancer. The second part is some of the rare variants of thyroid cancer may be a challenge to diagnose through pathology. One of the other cases that was highlighted on the session was actually a case that was misdiagnosed as a different neuroendocrine tumor, where in fact it was medullary thyroid carcinoma. So certainly there's those pathologic diagnosis challenges. And then certainly, as I mentioned, working on identifying the cases early on that will need this advanced therapy. So in my practice, unfortunately, I see sometimes cases that are referred to an expert center like us very late in when they have already either lost the window of opportunity for us to do certain systemic therapies, or when they have already undergone treatments that may limit my ability to use then the standard care line. So I think one certain message that we could have our viewers have, certainly for rare tumors, in advanced thyroid cancers, cases that are higher risk, whenever it's possible to consider referral for multidisciplinary expertise, to have both high volume thyroid surgeons and endocrinologists, oncologic endocrinologists, and medical oncologists that work with this disease every day.
Mhm.